Mm, Good morning, examiners. My name is Hina Bhargava, and I'm going to be the principal treating physiotherapist for 69-year-old female. A referral letter has been received to my clinic for this patient regarding some history and some information about the patient was that my patient has been diagnosed with Parkinson for the last 5 years. Recently, she's been experiencing some off time, having slowness in her movement, freezing episodes, and falls, which was like 2 falls per week lately. And she saw her neurologist. So, neurologist has done few changes in her medications. They have added dopamine and some adrenaline so that dopamine can absorb very nicely. So the referral was made by her neurologist to come and see the physiotherapist. So that's the all information I gathered about my file regarding her medical condition. I have also saw a note of the physiotherapist that for bed mobility she is independent with transfers like moving around sit to stand. She can do it, but she's really slow. Regarding her walking, I just got to know that she is walking with the close supervision with no aids. So I just wanted to know that is she living alone, or is she's got someone to to help her to walk around, since it's mentioned close supervision. So I just wanted to know when she saw the physiotherapist how she's doing exercises and all. um, Regarding her social and medical history, I couldn't gather anything. So we'll definitely confirm few things with my patient and subjective. So considering my patient age, about the referral letter, medication changes, I expect my patient to present with cardinal Parkinson sign, which is rigidity, bradykinesia, tremor, and postural instability. I also expect my patient to present with increased difficulty in turning around and freezing. My plan for this session is to assess her, like what was the reason of her falls, why she's having her falls, and how she's been managing it. I would be mindful about the yellow flags that can affect and could be one of my barrier in today's assessment. I just wanted to ask whether all these falling has caused any influence on my patient, like she's been very fearful in the movements or not, and how she's feeling since yesterday she had the new medication. So keeping all these things in my mind, I will plan my assessment and will give referral where needed, and will try to educate my patient to have a look around and how effectively we can put in place some falls prevention strategies in order to keep my patient's functional mobility upgraded and in line. So yeah, so I will carry few cones with me, masking tape, stopwatch. If I'll ask my assessor if that's okay, I can plan my if I can organize 2 chairs for time up and go test. And yeah, and I'll just enter into the room. So what's my patient name?
Joyce.
Choice. Okay.
20 minutes?
I'll do hand hygiene. I'll put my mask on and then I'll enter. Hello.
Hello.
Good morning, Joyce.
Hello.
My name is Hina, and I'm going to be a treating physiotherapist for today. How are you feeling today?
Good.
That's good. That's good. Joyce, I can see that you are leaning forward. Can you just relax yourself? Just be comfortable.
I'm very nervous about today here.
Oh, you're nervous. Why is that?
I don't know what's going on, so...
Okay, I just wanted to give you an overview. I'm just going to ask you a couple of questions since you visited your neurologist 2 days ago. Is that correct? So they have referred to you to us so that we can work on few things to improve your balance and just try to minimize your falls. You've been falling a lot, isn't it? So don't be nervous. If you want to share things, just share it with me, all right? After that, I'll just check your muscle strength. We'll do some movements together and we'll do some exercises,
Yeah,
all right?
sounds good.
Okay. Are you happy with that?
Yes.
Okay, excellent. So Joycey, just to confirm with everything, can you tell me your first name, last name, and date of birth, please?
Joyce Smith, and I'm 69 years old.
Beautiful. Okay. Joycey, can you see me and hear me well?
Yeah.
Okay, good. Do you use glasses at all?
No, I
No.
have pretty good eyes.
All right, okay. And Joycey, just for this session, my assessors are going to be here. Will that be all right to you? Thank you for your consent. All right. So, Joycey, I understand from your file that you've been diagnosed with Parkinson 5 years ago, and you have seen your doctor recently, and they have changed some medications. Is that correct? Okay. Would you like to add anything to it?
Yeah, I'm seeing my doctor quite frequently, but recently it's just like everything slowed down more, and I felt more
Yeah.
fatigued, and everything became so much more harder. So
I can
that's
see
why.
that you're speaking really slowly. All right.
Yes.
Okay. Right. So, what are your main concern or something that is bothering you, Joycey?
I do have lower back pain since quite a while.
Yeah. How
And
long ago?
I would say around about 2 years.
2 years. All right.
So I had quite difficulty with that, and the main thing is just the walking and freezing and being stiff all the time and
Yeah.
falls.
All right. False. All right. So quite a lot actually. So let's break it down and just ask. So I got to know that you've been falling a lot. So can you just tell me how many falls have you had in the last 12 months?
Oh, then when I count them, I'm probably 200.
200. All right.
But the good thing is, like, when I fall, I usually quite fall slow, so I haven't injured myself.
Did you hit your head at all?
No.
All right. So what were you doing when you had that fall?
It's usually at night time,
Night time.
or when I freeze, I freak out internally, and then I just like try to manage everything, and all of a sudden I just like fall.
Last week also you had some falls. Is that correct?
Yeah.
And is
I
it
have
happening?
2 bruises here on the left side. I was falling on my left.
Quite
hip,
painful,
so-
isn't it?
Mhm.
We'll be mindful about your bruises as well. All right. So you said that you've been following a lot in the night time. Is there any pattern to it? Like all the time you're just getting up to go to the toilet, or like what is happening?
I think just to stand up is hard, and
Okay.
I mean I do turn now the light on, what was usually a problem because I was just like, when you need to go at night, you need to go, but then it just like is hard to get up because I'm so stiff from laying,
Right. Okay.
and then I just like so afraid that I freeze more.
I completely understand, and thank you so much for sharing that with me. So freezing means you feel that your foot are stuck to the ground. Is that correct? Okay.
And then the
And
tremor kicks in, and I just like can't.
right. And what you've been doing so far to manage your falls? Have you done something about it?
Not
No,
really.
nothing.
That's why I'm
Alright,
here
okay.
at the Folds Clinic
All right.
today.
Okay. So I also got to know that recently you have started noticing this freezing and been following. I just wanted to know, like, when did you start noticing them? 2 months ago or a month ago?
I would say 2 months ago.
2 months ago. And before that, were you noticing these things quite a lot? No.
No.
So that means you're falling in the last 2 months. Is that correct? All right. And how are you doing things before 2 months?
Oh, that was quite okay. I just had like a little bit more problems with my right leg, and now
Mhm.
it feels like it's both legs involved,
Mm-hmm.
and I'm just like feeling me more stiff, and I can't do things more as I
Okay.
want to do.
Yeah,
Like
yeah.
something stops me.
Something stops you. Okay.
I want it. It does not happen.
We'll see what best we can do for you. So that means you're falling whenever you're walking during nighttime. Is that correct?
Just turning
All
as
right.
well.
What about during the daytime when you get up from the chair? Or
That is the same thing. I sometimes fall at night, I sometimes fall at day. It's
Mhm.
more about the freezing, or when I want to turn, or
right.
I do have 3 grandchildren. I look after them sometimes, and just they're 2, 4, and 7, and they're very quick.
Very
and
quick.
I'm too slow.
I know with the kids it's really hard. All right.
And the last fall from last week, I was just like wanted to get the 2-year-old,
Yeah.
pick it up, and I was just like could not do
Could
it.
not do
and
it.
lost balance.
Yeah. All right. Shame. And Joycey, I just wanted to ask you, like, is there any pattern to your falling? Like, for example, when once you're getting up, you feel that there is a complete blackout in front of you. You get dizzy.
No.
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 You lost your balance only while you get that freezing episode. Is that correct? All right. Okay. Not a problem. Now I just wanted to ask you, Joycey. Do you normally take your medications for Parkinson?
Oh yes. they are key, because
Alright.
otherwise you just only sit on a couch and watch TV all day.
Have you had your medications this morning?
Yes, I did.
Alright. How many times do you normally take your medications in a
3
day?
times.
3 times. Perfect. And they recently changed your medications, right? Yesterday? Did you notice any change at all? No.
I think it takes a while to
Yeah, that's correct. All right. Now, Joyce, I just want to ask you a couple of questions just to make sure no other reason associated with your condition. So I can see that you can speak really well. It's just that you're speaking really slow. Do you have any pins and needles or numbness in your arm? No.
No.
That's good. Do you have any headaches at all? Any migraine? No. Any neck pain?
Occasionally, but more lower back
Lower
pain.
back pain, right. And the lower back pain started due to falls, or it's been there quite a while? You said 2 years.
ago, yeah.
2
It's just like, I think from just sitting too much and
Sitting
being
too
stiff.
All right, okay. Do you have any trouble with your bowel and bladder?
I'm feeling quite constipated, and to use the toilet in the morning is
Alright.
a difficult thing, and I need to take medication.
Have you
for the
told your
setback.
doctor about that?
Yes, yes.
Alright.
I'm getting like something that makes it moving. You know?
Alright, okay, that's good. And when you take your medications, for example, in the morning, how do you feel about your freezing, and how do you feel about your walking? Do you feel
Better.
becomes-
Yeah, better.
And-
But it does not last as long. We have a time for around about an hour, 2 hours, and then
An
it
hour.
slows down again.
all right? Okay. What about the new medications? What did the doctor said that how long it's
I
gonna
mean,
last?
Yesterday I saw the neurologist. I got the medication. I took them yesterday evening and
Mhm.
this morning, so I can't tell you right now.
All right, not a
We will
problem.
see how it goes.
We'll have a look. All right. Now, Joyce, I just wanted to ask you, like, are you a smoker, or have you ever
Oh
smoked?
no.
That's good. Now, can you get up by yourself in the bed, turn around?
Yes,
Yeah.
that works.
All right, that's good.
It takes time.
It takes time. I completely understand. Right. But do you take any help while getting up from the chair?
No, but it's not as smooth as used
Really
to be. I
slow.
was a very active person.
5 years ago when
Mhm.
you've been dying. All right,
Mhm.
okay. Now I just wanted to know, like, how far are you walking these days? Just inside your house, or have you gone out as well?
I tried to go outside, but it recently decreased 2 months ago.
All
Before
right.
I was at least to go for a walk with my husband, because he was always getting me around his arms like this, and we were walking together. But it just stopped,
All right,
and I
okay.
don't want to be stuck inside.
Yeah, absolutely. No, we'll see what best we can do for you. So you're just walking inside your house? Were you using any stick or a wheelie frame? No, never. Have you seen any physiotherapists so far?
We tried, but we were not
All right.
liking each other that much. It was quite complicated. I think it was not the best physio for me.
All
So
right.
I'm having quite high expectations. But
I am really sorry about your
Yeah.
bad experience, Josie, but can you tell me, like, what sort of exercises were you doing, or what was the problem, if you don't
I
mind?
don't know. It was just sitting and trying with a stick.
Exercises.
Yes.
All
yes.
right. And how long ago was that?
I think we tried a month.
I've tried a month. All right. Now, Joyce, I just wanted to ask you, like, before you diagnosed with Parkinson, how far were you walking roughly? Just within the house?
Oh
How
no,
were you?
we were super active because
Super active.
my husband and I, we just joined a golf club, and
All right.
we really enjoyed it, and I'm just can't go at the moment.
Excellent.
I really want to go back to that. So we were hiking, golfing, everything.
And in the
fine.
last 5 years, is your walking has gone really down? Okay, and you're just walking inside your house, but you're not using any walking
Mhm.
stick. All right. Now, Joyce, I couldn't gather anything about your medical report. So, is there something that you would like to share with me, like any diabetes, lung condition, any heart problem?
I think hypertension, since I'm
Hypertension.
diagnosed with Parkinson as well.
Parkinson's?
So
All right. And how are you managing it?
I do get some medication. because of this
Medications?
as well,
Alright.
yeah.
That's why I ask you, like, whenever you're getting them, do you feel that your blood pressure is dropping down, or you feel a bit dizzy?
No, I usually have more high blood pressure than low blood pressure.
All right. What about diabetes?
No.
No? Alright, that's good. Apart from Parkinson medications and your high blood pressure, is there any other medications that you've been taking?
Mm.
No. Alright, that's fine. Now, Joyce, whom do you live with?
I'm with my husband.
With your husband, alright. And are you working these days?
I'm
or
retired.
You're retired. Any hobbies that you like doing?
Golf and walking. Oh, I don't know if I will be able to go back to golfing, but I do hope. I don't want to give up yet.
Yeah.
Don't want just sit in a golf car and just wait around till everyone else has fun.
Alright. So you
Right,
want to
so-
go back and play golf, isn't it? Alright. And do you have stairs at home?
Yes, we do. We live in a single-story house.
Single-story
We'd
house.
have, I think 6 steps.
6 steps. Do you have any
Front and
difficulty?
back as well.
Any difficulty doing that?
It takes time, and my husband helps me out with that. So to came here, he drove me, and it took like I think 20 minutes for
Okay.
6.
And whenever you're walking, do you feel that you need his help at all, like with
At the
holding
moment,
hands?
at the moment he is just like we are just like hooking each other with our
Alright,
arms.
okay.
Otherwise, I'm too afraid.
Too right.
Too many
Alright.
falls.
I
Don't want to break my hips.
Yeah, Joycey, and I'm glad that you have taken a step forward to share a few things
Yeah.
because it's very important to manage the falls. So, just the last question, like you've been saying that you are always falling in the night time. So, will you always use the proper shoes, put your lights on?
Yes, I learned this with the lights
All right.
after a couple falls, but usually it's just like I think to getting up out of bed.
And how's your bathroom? Is it like a very
We have quite a generous bathroom. That's
Okay.
okay. And we already put a lot of rugs up there just
Okay.
in case I fall. But sometimes I don't know. But I never tipped over the rug.
All
They're
right.
just like there. If I fall, that they
All
protect
right. But
me
you
a little
still
bit.
have some loose rugs in your house, isn't it?
Yes.
All right, okay. And do you also feel difficulty in turning around? Like, for example, if you're making something in the kitchen, if you turn around, do you also have?
Yes.
All right.
I could just make myself a cuppa, turn around, and go back to the couch.
Yeah.
But even for that, I need my husband.
All right, okay. But you don't do anything to help yourself, like any techniques or strategies, nothing
I
like that.
haven't learned anything recently.
That's all right.
So.
Have you seen any other allied health professional, like an OT or?
Yes, I got a referral for OT, and we have tomorrow appointment.
Oh,
So I think
that's
just
wonderful.
help me out with the cupper
That's
and
great.
like in
Yeah.
the bathroom and stuff.
Yeah,
Like
they can
this.
have a look at around your house to do a little bit of tiny bit of modifications
Yes.
to help you.
Yes.
All right, good. Now, Joycey, I wanted to know how can I help you in today's session?
I think just strategies for falls prevention
Yeah.
might be important.
Yeah, perfect.
And
Yeah, and what would you like to go back in couple of weeks?
walking and golf
Walking. Walking in the sense like you wanted to walk
outside.
outside.
Yes.
Okay. More freely.
Yes.
Okay. Right. Okay. Now, Joycey, like you said that you want me to work on your falls. We just need to see and identify those areas which are troubling you at the moment. So I will be able to guide you better after doing my hands-on. All right. Okay. Great. And you said that you want to walk outside. So just going outside first to the mailbox or post box and then coming back. Like, just
Yes.
wanted to break it down.
Yes.
All right. Beautiful. Because since you've been following and quite lately you haven't gone out at all, isn't it? All right, beautiful. Now, Joycey, what we will do is, are you comfortable at the moment?
That's okay.
All right, okay. Now you're sitting in a chair. What I'm going to do is I'm just going to observe you how you're sitting. So I can see that you do have some tremors. Is it also these tremors are also bothering you whenever you are eating or cooking? All right. Have you told your doctor about it?
Yes.
All
Yes.
right. With tremors, medications always help, and if we do some strength training, then that it can also help you. Now, what I can do is I can see that you're really stiff from your core. So let's make you a bit more comfortable. Can you lean back in the chair? Excellent, that's good. Now, Joycey, you said that you can see me really well, so I won't be doing your vision at all. I'm just going to check some couple of movements in your arms and in your hands. All right. So can you put your hands behind your head for me? Excellent. Now can you put your hands behind your back for me, please? For that, I think so you may have to lean forward a little bit. Okay, beautiful. Bring your arms to the front. That's good. Can you touch your shoulders? Hold it there, all right? Don't let me move you. Excellent. Push me back. Good. Good. Push me back. Great. Can you squeeze my fingers as hard as you can? Oh my God. Excellent. That's good. All right. Let's check some couple of movements in your legs, all right? Can you lift your right knee up and touch my hand? Hold it there. Don't let me move you. All right. Can you lift your left knee up? Hold it there. Okay. Right. Can you kick your leg out? That's good. Can you bend your leg in? Good. Can you kick your leg out? Can you bend your leg in? Good. Can you lift your heels up?
There's still some strength there.
Yeah. Can you lift your toes up? Hold it there. Good. Hold it there. Good. All right. Strength is looks good. It's just that your right side is bit strength is bit reduced as compared to your left. Now what I'm going to do is, can you feel the difference between hot and cold whenever you're taking showers?
Yeah.
Let me just quickly check. So are you wearing your slippers?
I'm
shoes?
barefoot.
You're barefoot?
Yeah.
Okay. Do you need any help while taking off your shoes at all?
Taking in general at home.
Yeah, general at home.
I can do it. It just takes time, but I do have time, so I can do it. Yeah.
Okay, that's good. Now I'm just going to stroke my finger on different parts of your ankle. Let me know where I'm touching. Just close your eyes and say right and
Would you
left.
mind just like, do you have a pillow or something for my back?
I can
Because
do
it's
that.
just like, yeah, thank
I
you.
just wanted to ask you a couple of things as well. How much is your back pain at the moment?
It's,
Out of 10?
it's quite. It's a 7.
7, alright. And can you just show me whereabout you're having the pain? I'm having a look. Is it just here?
Yeah.
Alright. If I'm touching, do you have any pain?
It's tight.
It's just tight.
Tender, yeah.
Alright, we'll see. Alright, you can lean
Yeah,
back. How
better.
does that
Thank
feel?
you.
That's
Thank
alright.
you.
Alright, so you have to close your eyes and tell me which side I'm touching, alright?
Right.
Good?
Left.
Is there any difference between these two? Alright, that's good. You can open up your eyes now. That's good. Now, I'm just going to check how well you can perform some movements, alright? So, I'm going to place my finger in front of you, alright? And I would like you to touch your nose with your right index finger and touch my finger, alright? So, touch your nose and touch my finger. That's good. Can you do it a couple of times for me? Alright, one more time. Perfect. What about with your left hand? Good.
I know it's not super bad.
That's okay. No problem. We are just checking it. Alright, not a problem. That's good. Now, let's check your leg movements now. So, without moving your right heel, can you tap your right foot down? Right one first.
I'm sorry.
That's alright. Okay. And down. Perfect. With your left one. Alright. Okay. Now, Joyce, I just wanted to ask you one more thing that have you been noticing any difficulty in thinking or memorizing things? Do you feel?
It's difficult.
It's difficult.
Like when I remember, I can't remember your name. I'm so sorry.
That's
but it's
alright.
Just like,
That's okay. My name is Henna.
yes, thank
That's
you.
alright.
Hannah.
So how do you manage everything, like your groceries, your appointments,
My
and
husband.
your husband does that?
Mm,
Alright.
I
Is
would
he
like
here?
to take more action in general.
Yeah.
And to just like, because it's the same with the brain, when you don't use it you lose it, and I'm feeling I'm losing a lot of things at the moment.
What I can suggest you to do is just keep a small diary or a notepad, whatever you feel, just print out and write down in your diary, so that it will be easy for you, so that you don't miss out any important appointments. Alright, so the next step is, Joyce, I just wanted to check how good your sitting balance is. So I can see that you're not taking any help from the back, so that's
I
good.
do have the support from
Alright, so can you scoot forward a little bit? Excellent, good work. Alright, okay, can you straighten up yourself? Nice and tall. Alright, I'm just going to give you a little bit here. Alright, I'm just giving you a little bit of cue, alright? I want you to push back from your shoulder and just, beautiful, that's it. Doesn't have to be a stiff one, just that it's, alright, okay. Alright, now Joyce, can you look over your right shoulder for me? Now can you look over your left shoulder for me? Excellent, good.
never do this stuff anymore.
That's alright. Your sitting balance looks good. I just wanted to check the tone of your muscles, alright? So I'm just going to borrow your hand for a minute, right? And I just want you to relax. Alright. Yeah, there is some stiffness going on. Yeah, alright. Relax, relax. Okay, and relax. Alright, okay. Now, I'm just going to check whether you can feel the movement change in your joints. Alright, so I'm just going to Imagine I have checked the proprioception. Going to put your leg on top of my leg.
Just quickly.
I can help
Grab
you a little bit.
this.
That's good. You can grab things from your side as well. That's good. And have a seat. All right. So I've just checked the proprioception as well. All looks good. Now, Joycey, the next step would be I would like to see how you are doing things at home. All right. So I've already placed 2 chairs around there. I just wanted to check a walking distance. We call it time up and go. So what this test involves is you are going to stand up nicely. You will walk around, walk straight to the 3-meter distance. There is a cone. Turn around from that cone and come and sit back on your chair.
Yeah.
And I'm just going to time you up. All right. But before that, we have to do certain things. All right. So in a moment, I will ask you to stand up. Just be mindful. Do it as normally as you're doing inside your home. And I will be standing on your right side. Okay? You don't have any difficulty while getting up from the bed, do you? No, but you can do it.
No, I can
All
do
right.
it.
So I will be standing on your right side, Joycey. Can you stand up for me, please? All right. Standing up, up. All
Just
right.
back. Yeah.
Just the back. Have you been doing anything for your back?
No.
No? All right. We'll have, if time permits, we'll have a look at your back as well. But it's very important for us to prevent your falls at this stage. All right. Joycey, I can see that you were struggling a lot while getting up. Who told you that rocking up movements?
This is just how it works.
You
How
do
it
it?
goes for me. Yeah.
All right. Just wanted to do some checks with you before we go for a walk. Can you take a step forward with your right leg? Excellent. Bring it back. What about with your left? All right. That's good. And back. Good. Can you take a side step with your left leg? Excellent. And bring it back. Good. And what about with your right side? Excellent. And bring it back. Good work. So Joycey, let's go and walk together. All right. And we will be doing that time up and go test. All right. Okay. So yeah. So Joycey, we are out now. Okay. So you can see that the cone is there in front of you. In a moment, I'll stay ready, steady, and go. You just have to sit down on your chair first. Alrighty. In a moment, I'll say ready, steady, go. When I say go, you have to stand up, walk around, turn from that cone, come back and sit. And I'm going to stop the stopwatch when your back will be, whenever you are sitting comfortably. Alright? Good? Okay. And Assessor, I would like you to walk with Joycey on the right side. So Joycey, just to keep your safety in my mind, my assessor is going to walk beside you. Anytime you feel that you're losing balance or having that freezing episode, you can hold on to them if you feel like.
Yeah.
Examiner, all good? Okay, correct. So Joycey, ready, steady, and go. Alright, and I'll stop the watch. Okay, Joycey, how do you feel about it?
Tough.
It's tough, yeah. I have noticed few things while you were walking. It's just that you're standing up, you're taking quite a lot of time while getting up, and plus you have just got 2 freezing episodes while you were turning, and I noticed that you were about to fall, but still you have just managed yourself to stand upright, and you took 54 seconds to come back and sit. Normally with the average score of this test is 13.5. That means you took way more time.
I know.
Yeah.
I know.
So that indicates that you are on the high falls risk, and we need to do some strategies how we can prevent that. All right. So like you said that you want me to work on your falls, and I feel that if we are going to learn some unfreezing techniques and to be able to turn around well, we will be able to manage your falls. Plus, I would strongly encourage you to, if you're going If you are getting up from the bed, take your time, no problem with that. Turn around the lights, just sit around if you want to, and then take a minute and then go back. All right, so we'll do some exercises. How does that sound? All right, that's good. So Joycey, like you were sitting, we will do some exercises next to the parallel bar. All right, so the first exercise would be, I would like you to stand up, please, for me.
Easier said than done.
That's all right. That's good. All right. So I am just going to put some markings around there, and I would like you to tap the marking and come back. Okay. While we are doing these exercises, I want you to lift your leg up, tap, and then come back. All right. So like tap and come back.
Only
Tap.
with the right.
Only with the right
Okay.
first.
Good.
So while crossing the leg, it will help you to take a turn. All right. That's all right. Maintain your balance. So we are doing tapping in different directions. That's good. That's good. Okay. That's good. And now we will do it with your left now. So with the left leg, tap front. Good. Okay. Now Joycey, I want you to lift your leg up and then tap and then lift and come back. Excellent.
It's just hard to.
That's all right. You can hold on to the parallel bar first, just to get a hang of it. Good. And then sideways. How are you feeling, Joycey?
Yeah, that's holding
better.
on to something. Is
That's
better,
good. Now can you just hold on to the parallel bar with 2 fingers? Good. And now tap it and then come back. Excellent. Again tap it and come back. Excellent. Joycey, I would like you to take some rest, please.
Okay.
That's good. All right. Now, the next exercise is we really want to work on your sit to stand. All right. So the first thing would be, whenever you are getting up, make sure that you're scooting forward. Okay. So scoot forward, wriggle forward. Excellent. Make sure that your hips are always higher than your knee. All right. That's a good thing. Do you normally sit on a low chair at home?
I think they're like this one.
Normal one?
Yeah.
Maybe you can have some more cushions around there so that it will be easy for your hips to work around. Okay, we'll work on that as well. All right, now the next step would be to gain some movements around your spine. I want you to cross your arms like this. All right, and just turn over your right shoulder. Good. And turn over your left shoulder. All right.
Feels actually quite good.
Yeah, because all the time you're hunching forward, so all these muscles, they become really stiff. Turn around. Look at me, Joycey. Look up. Great. Turn around from your right. Excellent, Joycey. Can we do it a couple of times?
Yeah.
How's your back pain at the moment?
Oh no, it feels like
That's
it's
good.
loosened up.
Do you think you can do this exercise at home?
Yeah. I
For
just have to
example-
remember.
Yeah, that's good. All right. Okay. Now let's do some forward movements and coming back. So I want you to lean forward and come back. Lean forward and come back. Lean forward. Do you feel that your hips are coming up? That's good. Feel the weight going through your legs. That's good. That's good. A little bit more, Joycey, and you can do it. Excellent. Right. Now, on the count of 3, we are going to get up. Okay?
With hands here.
Yes.
Okay.
With hands here. Yep. No, on the count of 3. Keep doing that momentum. Feel the weight through your legs. All right. So 1, 2, and 3. Standing up. Excellent, Joycey. How does that feel? Good. Let's practice that again. I want you to sit down, please. That's good. Now, I want you to use your hands if you can, all right? So always 3 steps. Wriggle yourself forward. Do some forward movements, all right? And I'll just show you how much you can feel. Not that much.
Hands again here.
If you can put your hand down, not a problem. Just feel it. Just feel that the hips are coming up, all right? And then you have to stand up. Okay? Good. Now you are in standing. How are you feeling?
Yeah, good.
That's good? Okay. Now, Joycey, we will do some techniques for your freezing, all right? So every time when you feel that you're getting stuck, stop there. Take a nice deep breath, okay? And just do some marching. Yeah. 1, 2, 1, 2, 1, 2, 1, 2. Excellent. All right, and then start your walk.
Mhm.
Try not to walk whenever you're
Mhm.
getting freezing. Stop for a minute, breathe, and then count and then walk. Okay. We'll see if we do some testing again, and if I feel that you're getting some freezing, but till the time you're not getting anything. So now you remember we did some touching up.
Mhm.
Okay. So I'm just going to repeat the test again with you.
Mhm.
Okay, and we'll see how much improvement we have made. Okay.
Mhm.
So I want you to sit down again. That's good. So again, in a moment I'll say ready, steady, and go. When I say go, you have to walk 3 meters, turn around from that cone, come back and sit on your chair.
Yes.
And assessors, I would like you to again walk with Joycey. If you feel that she is a bit unsteady or unsafe, just give her a hand to hold or support her from the sternum or one hand on the back. All good? All good, Joycey? All good. All right. So, ready, steady, and go. Any better?
Yeah, it was a bit faster.
Maybe few seconds. All right. So, Joycey, what I noticed that you're getting up from the chair really nicely. Last time you took 7 seconds to get up from the chair. This time you just took 4 seconds. So that was a good thing.
Better, yeah, 100%.
Yeah. And I feel that your back pain is coming from the muscles that are getting really stiff. So now we have to do some home exercise program, okay? So I'll just give you some couple of easy exercise that you can do throughout your day. I don't want you to just think about, oh, I have to do exercises. Just think that whenever you are in one position, just try to utilize it, all right? Okay. So for the falls prevention, the good thing is the OT is coming to review her house. That's a great thing. Maybe they can do a little bit of modifications for you. Keep yourself hydrated. Drink water, and that's a good thing. Whenever you are getting up in the night time, make sure that your night bulbs are on, and take a moment and then go to the toilet and do your stuff. Whenever you're getting freezing, stop there, hold on for a minute, and then continue doing that. And I would like to see you after 5 days. Let me know how you're feeling about the change in your medications, and then we can take it forward. But I've just got a baseline measurement of in today's session, and I'm going to share all these assessments with your neurologist. And I would like to see you. Yeah, I said I would like to see you after 4 days.
Yes.
And with the home exercise program, just cuddle yourself nicely. Just do some rotations to the right and to the left. It will help you to reduce your stiffness. That's a good thing. Even you can hold on to your hand like that in the front. Right hand all the way to the side. Feel that the shoulders are moving, and then your left. Just do it 5 times with me, and just let me know if that feels okay with you. That's good. Okay, so do that 5 times. If you are sitting in a chair, you can do some marching on the spot. So I would like you to do these 3 exercises until the time. That's a very good question, Joycey. I would like you to do these exercises 3 times in a day. But for example, if you're watching a telly, you can do marching as many times as you can, because the brain is still healing and learning new things. And for example, if you're having your tea or something, you can do some rotation. So it's up to you. But my recommendations would be, the more you'll do it, the more it's going to ingrain in your brain.
Okay. How can my brain heal when I think it gets even worse?
That's a very good thing. I would like to give you an analogy. For example, with the baby doesn't know any language. But as he gel up with the family and condition himself, he learns different languages. Exactly the same thing happening with your brain. The more you tell the brain that, hey, I'm going to do this pattern, it's going to register in your brain. It's like a computer desk. The more you'll do work, the more it's going to record in your brain. It's never too late.
Yes.
All right? So we have to work on your falls. So take your medications on time, stay hydrated, and just do these exercises religiously. And also, if you have any trouble or any problem, keep on documenting things in a small diary. And if your husband is around here, and if you're happy, I can share all these things with them as well. All right?
Okay.
Okay, beautiful. So I'll see you next week.
I do have more questions.
Yes,
Do you
absolutely.
think I need a walking aid, anything? A helper?
That's a very good question, Joycey. At the moment, I checked your walking and everything. I think so. Walking it wouldn't be a nice thing to add in today's session. Like you can know you have, you can manage yourself really well while walking. It's just that the freezing and the stiffness around your back. Maybe in the next session we can try to do some walking. But as your husband is there around you and he's been helping you a lot. So I wouldn't fixate giving you a walking aid, but in the next session, if I feel that you are really struggling a lot, we might introduce a walking aid in today's session, in the next session.
Okay. Do you think I will ever get better?
With the Parkinson, what do you understand by your condition, Joycey?
It's just that it, for me, in my experience, it's 5 years. It's just like went worse, and that's why I'm just like, of course, there was something else will come, but I really want to go back to golf. So
Yeah.
that's why I'm wondering if I ever will be able to go back to golf.
Okay, so with the Parkinson, it's a very progressive disease. Like, yes, the diseases keep on progressing. You will see signs and symptoms. But what we can do is, we can learn some strategies how effectively we can manage the symptoms. Like, for example, if you're having difficulty in walking, we can do some exercises and train our brain. Unfortunately, it is the natural course of the Parkinson, and we can't do anything. But we can take some medications on time to reduce the effect. Do some exercises. I'm very, very, very happy that you do have a goal, that you always wanted to go back to golf. However, to go back to golf, you need a good balance to be able to walk and manage few distance. Like you said, you're not been walking at all that very far. So let's break it down and do some couple of exercises and make some realistic goals at the moment. Like every week we are going to review that in order for you to go back and play golf. How does that sound?
Yeah, sounds good.
That's good.
Okay.
Do you have any other questions for me?
Not at the moment.
Okay, so I'll see you next week, and I will give you a leaflet for the exercises in case if you get a bit more overwhelmed with the exercises. All right? Okay, good.
Thank you.
Thank you, Joycey.
Thank you.